Okay, so we're now going to move on to our CPR routine, which stands for Cardiopulmonary Resuscitation. And the situation here is that we've done our primary survey, our Dr. ABC routine. So we've checked for danger, we've checked for a response, we shouted out for help, we opened the airway and checked it was clear, we then checked for breathing. And this time, when we checked for breathing, we identified that the person wasn't breathing normally. So at this point, what we do is, rather than continuing with our primary survey, which means check for any life-threatening circulatory problems, we're going to stop there and we're going to deal with that breathing problem straight away, which means we're going to start our CPR routine. And the CPR routine, when we start this, the first thing we're going to do is we're going to call for an ambulance straight away. So we're going to get out our mobile phone if we have one, and we're going to call for an ambulance straight away. Or if we don't have a mobile phone, we're actually going to go off and make that phone call before we deliver any CPR. Now, the question we always get is, well, why would you do that? Why don't you do a little bit of CPR, and then if it's not working, call for an ambulance later on? And the reason for it is because CPR alone isn't designed to get the person breathing again. Instead, the CPR is designed to buy you some time until that later help arrives. CPR only actually gives you a 2% chance of getting the person to breathe again by delivering the CPR alone. Instead, what it's going to do is it's not going to get the person to breathe again, but it's going to keep blood and oxygen circulating around that body, which will keep the body tissues and the body organs alive, which means when the ambulance arrives and they take this person off to hospital, if they have to perform an operation in hospital on this individual to sort out the problem that's going on inside them, they'll be operating on someone that's still got living body tissues and living body organs, because your CPR has been helping to circulate oxygen and blood round to those body tissues and body organs in the first few minutes when the situation occurred. Okay, so just to be clear, CPR only gives you a 2% chance of the person breathing again. The main reason we perform it isn't to get the person breathing again, it's to buy you time until that later help arrives. And for that reason, we always want to make sure we call for an ambulance straight away before we do anything else, to make sure that our help is coming and is going to arrive as quickly as possible. So first thing in my routine, I take out my mobile phone, I make that phone call. If possible, we'd recommend you put your mobile phone onto the floor on speakerphone and you start calling for emergency help on speakerphone while you start your CPR routine. And it's just going to speed up the time until you actually perform your CPR. Once you've made that phone call, we're then actually going to move into the CPR itself. And the CPR is made up of two components. It's made up of a series of compressions and a series of breaths. Now, the breaths are only if you're willing and able to do them. So if you're not comfortable delivering the breaths for whatever reason, perhaps the person's got blood across their face and you don't want to deliver the breaths for that reason, that's absolutely fine. You can do compression only CPR. But if possible, we would recommend you do both the compressions and the breaths, because that will give the person the best chance of survival. So once we've called 999, to start our routine, we're going to start with 30 chest compressions. To do these, I'm going to use this hand posture, like so. Now, if you find this uncomfortable, maybe you've got difficulty with your wrists or you're wearing lots of jewelry, a good alternative might be to take one hand like this and one hand over the top like this. But I'm going to be using this hand posture today. And we're using this hand posture, I'm going to place the base of my hand onto the center of the person's chest here. And on the mannequin here, it'll be on the zip in between the two nipples. If you feel yourself, you should be able to feel a flat bone here, which we're going to be pressing down, your sternum bone. You don't want to get it too high, too low, you want to get it right in the center here. Now, when you press down on yourself, it doesn't feel like it's going to go anywhere. But if you're on a hard, flat surface, this bone goes down fairly easily. Okay, so we're going to place the base of our hand onto that location. Also notice a few other things. Notice that the tips of my fingers are raised up off the chest. This is so that when I press down, all of the pressure is going through this small surface area at the base of my hand. It's not spread over the whole surface area of my palm of my hand. Also notice that my arms are fairly straight and my shoulders are directly above my hands, meaning when I press down, all of my body weight is going to go into this. Once I've got my hands in this position, I'm now going to deliver 30 chest compressions. I'm going to do these at a rate of 100 to 120 per minute, which is roughly the same as the beat to staying alive, or it's 2 per second roughly. Okay, so boom, 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 boom. I'll let you sing the song yourself. But I'm going to do them 100 to 120 per minute. It's roughly 2 compressions per second. And when I press down, I'm going to be going around a third of the body depth, which on an adult body will be around 5 to 6 centimeters. And it should look like this. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Once I've delivered 30 chest compressions, I'm now, if I'm willing and able, going to deliver 2 breaths into the airway. Now when it comes to these 2 breaths, the first thing I need to do is I need to tilt back the head like we were doing this morning, just to open up that airway. I'm also just going to open up that mouth with my fingers. I'm now going to place my lips onto their lips to create a seal. I'm going to pinch the nose so that when I breathe into the mouth, the air doesn't rush back out of the nose. And I'm going to do a full breath into the airway. I'll release for a second, and then I'll deliver a second breath. Now you should see the chest rise slightly there, letting me know that that breath's gone in. If you don't see the chest rise, meaning the breath's failed, it doesn't matter. Don't give the breaths 3, 4, 5, 6 attempts until you see 2 breaths go in. Just do your 2 breaths and move on, even if they don't work. The key here is that we're not faffing around wasting too much time on the breaths. We give 2 breaths a go. If they don't work, that's fine. We're just going to move back to the compressions. We don't want to spend too long on those breaths because the compressions is the more important part. Once I've done those 2 breaths, I'm now going to go back and I'm going to deliver a 30 chest compressions once again. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once I've done that, I'm going to go back, I'm going to deliver another 2 breaths, and I'm now just going to keep going. 30 compressions, 2 breaths, 30 compressions, 2 breaths, over and over again. We'd only recommend you stop in a couple of different situations. First of them would be if on that 2% chance, the person starts breathing again. Usually the person won't sort of start talking to you, you'll just notice some small subtle breaths. At that point, we'd recommend you put them into the recovery position and you just monitor them because there is a chance they could relapse and stop breathing again. Other reasons why you might stop would be if a paramedic arrives and takes over from you. However, please note that if a paramedic arrives and sees you're doing good CPR, they might tell you to keep going for a few minutes while they get the rest of their equipment ready. So don't stop until there's a paramedic right in front of you telling you to stop because they're going to take over. The third reason that you might stop would be if just another first aider is taking over from you and therefore you can kind of swap with them. We'd recommend that roughly every 2 minutes, if possible, you do swap with another first aider just to make sure that you're getting the best technique and the person isn't too tired when they're doing it. The fourth reason that you might stop would be if there's a danger to your health. So if there's a fire spreading and you need to get out of the way, obviously you can stop because you need to put your life first before the casualty on the floor. And the final reason you might stop would just be if you're too exhausted to continue yourself. Now we'd hope that you get an adrenaline rush and you just keep going for as long as you possibly can, but if you're too exhausted to continue, then obviously you can stop yourself because once again, your life comes first. So that's our CPR routine. What I'm now going to do is I'm going to repeat the routine all the way through. I'm going to do primary survey into the CPR routine. I'll then stop and we'll move on to the next bit. Okay, so here we go from the top. I'm coming in, I'm checking for danger. There's no danger. I'm going to check for a response. Hello, can you hear me? Can you hear me? Can you open your eyes? There's no response. Can I have some help, please? I'm now just going to open the airway, check that the airway looks clear, and I'm going to check the breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In this case, the casualty isn't breathing normally, so I've either picked up on no breaths at all, or I've just got 1 or 2 irregular noisy breaths, which remember we called an agonal breath. So in this situation, I'm going to start my CPR routine. The first thing I'm going to do is I'm going to take out my mobile phone, I'm going to put it on speakerphone, and I'm going to start making that 999 call as quickly as possible. While I'm doing that, I can move into my CPR. I'm going to start with 30 chest compressions. So I take my hands onto the center of the chest. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. I'm now going to deliver 2 breaths. I'll go back in another 30 compressions. And I'm now just going to keep going. 30 compressions, 2 breaths, 30 compressions, 2 breaths, over and over again. I would only stop if the person starts breathing again on that 2% chance. A paramedic arrives and takes over from me. I'm swapping with another first aider to make sure we get the consistent best technique we possibly can throughout this sequence. There's a danger to my health, which means I need to get out of the way, or alternatively, I'm just too exhausted to continue. That's our CPR sequence. You're going to be all practicing this and going through that routine as I've just demonstrated it when we come to our practical face-to-face assessment session at a later date.